Hello, everyone, and welcome to the 2020 Rural Health Clinic Workshop presented by the Oregon Office of Rural Health. My name is Rondie Ann Gerst, and I am the Rural Health Clinic Program Manager and will be the moderator of this session today. First, I would like to thank our partners, Gold Partners, All Care Health, and Oregon Rural Health Association. Silver Partners, Eastern Oregon Coordinated Care Organization, Oregon Association of Hospitals and Health Systems, and River House on the Deschutes. Bronze Partner, RQI, and our Copper Partners, Westcom, American College of Education, and INQUISEQ. Their continued support during these difficult times has made it possible for the Office of Rural Health to offer the conference and workshop at no cost to you. You should have received an email with the link to our conference app. Use this app to visit our partners' virtual booths and enter to win prizes, network with others, and share photos of your clinic, providers, or community. We would love to see them. Virtual workshop instructions. During this presentation, your audio is muted and your camera is off. We will be monitoring the Q&A box during the presentation. Please use the Q&A box to add your questions for the presenter. We will have time at the end of the presentation to answer questions. If you experience technical difficulties, please let us know by using the Q&A box. For best viewing experience, we suggest you use floating panel view. The slides, recording, and any unanswered questions during this session will be posted shortly after the workshop on our website. Session evaluation. After this session, you will receive a survey. Please help us continue to make improvements by completing the survey. In addition, this is how you will receive your CE credits, and you will be entered in a drawing to win a $100 gift card. To present wraparound payment process, please welcome Jennifer Smith, Safety Net Clinics Program Manager at the Oregon Health Authority. Welcome, Jennifer.
Thank you, Rondie Ann. Hi, everyone. I'm Jennifer, and I'm going to talk to you about the wraparound payment process. I put supplemental in quotations because that's how the federal government refers to the wraparound process. So just so you know, you'll see that throughout the presentation. So just a few things to get started. I want to make sure everyone knows the acronyms. I'm sure almost everyone knows these, but OHP is the Oregon Health Plan. And then you'll hear me refer to OHA, which is the Oregon Health Authority, and possibly HSD, that's the Health Systems Division within the Oregon Health Authority that administers Medicaid in Oregon, which is OHP. CCO is a coordinated care organization. Those are our managed care entities in Oregon. And then wraparound supplemental payment. This is payment that we make to the clinics to make sure that their encounter rate is made up for when they get paid a different amount from CCOs. And then we probably won't touch on it too much, but I wanted to put out there that we have an APCM that some of our clinics are involved in. It's mostly FQHCs, but some RHCs are also enrolled in that program. So that's the Advanced Payment Care Model. And if you have any questions about that, you can send me a quick email or give me a call, and we can talk about how that's different than the basic encounter rate reimbursement. So our agenda for wraparound payment, I'm going to talk to you about the purpose, why we have a wraparound payment, what's included in that payment, what you need to include on those reports, any exclusions we'll talk about. I'll show you the template and the data reporting, and then I'll go over some frequently asked questions that we get from clinics. That'll include global billing, third-party liability, case rates, and how CCO encounters work in MMIS and how we actually get to that calculation once we get the wraparound report from the clinic. All right, so a little bit about the purpose and process of the wraparound payment. So the wraparound is a federal requirement, and again, they refer to it as a supplemental payment. We are required as a state Medicaid agency to pay rural health clinics, federally qualified health centers at an encounter rate. It's a cost-based encounter rate. So we develop those rates off of qualified costs. And then we have managed care entities. So our CCOs, where 90% of our OHP population is enrolled in a CCO or assigned to a CCO, and clinics are billing the CCO for the services. And those CCOs may not pay the encounter rate, which we're required to pay as a state Medicaid agency. So the purpose of the wraparound is to make sure that the clinics are still receiving their cost-based rate for qualified services. So for services that are encounter rate eligible in the first place. So we are required as a state Medicaid agency to make the clinic whole. You'll hear that term a lot, at least every 4 months. So that's the purpose of the wraparound payment and process. And here is the process. So you're providing services to many people, including OHP members. And again, 90% of them are assigned to a CCO. So you're providing the service and you are billing the CCO. And then the CCOs are submitting encounter data to our information system. So that's the MMIS. And then the clinic submits a wraparound report to OHA directly. And that includes all the encounters provided to the CCO assigned members. And then you're also reporting all the payments that you received from CCOs and from other parties for those specific services. And then we look through that report, we compare it to the encounter data that's in our MMIS, and then we settle up and send out a wraparound supplemental payment to make up that amount. So responsibilities, again, this is a little bit of a repeat, but I want to make sure that it's outlined that the clinic is billing for services and receiving payment from all the payers, depending upon each individual's coverage, and then submitting a wraparound report to OHP so that we can make that amount up to the encounter rate for encounter rate eligible services. Now you'll notice this bullet says quarterly wraparound. And I know that a lot of rural health clinics are submitting the wraparound template on a monthly basis. And I just want to make sure that I call that out, that we're required, the OHA is required to settle at least every 4 months. And so we put a quarterly process into the rules. But as I discussed with my fiscal analyst, he said that a lot of RHCs are doing that monthly, and that's just fine. Our responsibility, we need to review all of the information that is submitted on the wraparound report. So you're putting all of those services on the wraparound template, all the amounts received. We're comparing that to the encounter data that the CCOs send to us into our system. And then we calculate and issue that wraparound payment. And at the bottom of this page, you'll see who you submit reports to. This is our fiscal analyst that manages the wraparound process for us. And you'll see that again later in the presentation, so don't feel like you have to jot it down real quick. Okay, inclusions and exclusions. I want to point to the rule around wraparound payment. This is the Oregon administrative rule that manages this for FQHCs and RHCs. So OAR 410, 147, 0460. And then we'll also talk about the template and reporting in this section. This is page 1 of the template. So the template is on our website. So you can access it at any time, and this is just the front page of the Excel. This is kind of the overall information that you're submitting for the entire wraparound payment. So you can see expected number of encounters, your PPS rate, some capitation amounts, risk withhold payments, different types of payments that you would have received. So this is the overall page 1 of the Excel. And then this is what you would include. So I'm referring to that front page as a cover page. And you will include costs incurred, so the expected number of encounters, and the clinic's PPS encounter rate. And then any payments received for each of the services. So this would include any capitation payments, CCO payment amounts, Medicare third-party liability, any interim payments from OHP. I do want to make sure that I mention here that there is a spot on the cover page for risk withhold payments, and we do require that you report those, but I do want to distinguish, we do not want any bonus or incentive payments reported on the wraparound. Those are outside of the wraparound because they're intended to be bonus payments, and we feel like we would, well, it's a federal requirement, so it's not just what we feel like, but it would disincentivize the clinics if we ask them to report those bonus and incentive payments on their wraparound. So don't include those ones. And this raw data, this is actually the second tab of that Excel file, but it's very large and kind of linear, so I didn't want to try and fit it on a slide for you. But what I did is I took the headers and I listed them out in a bulleted list, and the required fields are in italics and bold. So all the fields are there. The ones that we absolutely need for each encounter are the first and last name, the prime ID, that's the Medicaid ID of the patient, the date of service, the procedure code modifier, the diagnosis code at the detail, because you're listing each service, the MCO paid claim detail, so that's the CCO really, managed care organization, and then any Medicare paid claim detail, if that's applicable, will also be required. All right, so exclusions, I did mention the bonus and incentive payments, and I'm just going to mention it again because I didn't type it out here. This payment is really designed to make up the difference between what you receive from other payers and what you would have received by the state Medicaid agency had you billed us directly for an encounter eligible service. So payments are in aggregate, and some exclusions. You don't want to include services for the following OHP members. So we have qualified Medicare beneficiaries. So those are indicated in our system by MED. If you're looking at our MMIS to verify eligibility, you'll see these listed as MED. These are individuals who have Medicare, and they are in our system because we help them pay their co-insurance and deductibles on services received. But they're not quite at a point where they're eligible for the full OHP package. OHP Plus is what we refer to that as. We also have a group of individuals that are citizen alien waived emergency medical. We refer to them as CALM. You'll see them in the MMIS as CWM. Those individuals are not eligible for the encounter rate. And then we have a population that's a little bit tricky. Cover all kids, and a lot of the time you'll hear this referred to as CAT. These folks are listed in the MMIS as BMH. BMH indicates OHP Plus. That's the full package. And the way that you can distinguish these individuals from others who have the full coverage is by a PERC code. And then I've listed out the PERC codes there. So when you're in the MMIS and you're verifying eligibility, you'll see the person's PERC code. And if it's one of these, CK, CL, CM, CN, CO, CP, or CR, you want to exclude those from the wraparound. Now, if you submit them, I don't want anyone to get too worried about including them on there. We'd like you not to. We are not going to pay wraparound for those individuals. But if they're on there, we have a process to remove those from the wraparound report and just not pay on those. So I don't want you to work too hard I don't want you to worry about whether or not they're submitted on there. Also, you don't want to include services provided under a separate Medicaid provider ID. So we have rural health clinics and federally qualified health centers who have separate enrollment for certain services, for example, pharmacy or durable medical equipment. So you have to enroll separately as a pharmacy or a DME provider to provide those services. You only want to include on the wraparound services that are provided under the specific rural health clinic Medicaid ID. And then a few frequently asked questions. So global billing. A lot of the CCOs require global billing specifically for OB codes and maybe some other things. We don't pay those on a fee-for-service basis. And because this is a wraparound settlement for encounter-eligible services, we need those to be separated out by service. So even though you may build the CCO a global code, we need to see each encounter listed on the wraparound report so that we can match those up and make sure that we pay you the difference between an encounter rate and what the CCO may have paid you for that global code. And then, of course, report the global payment when you receive that as well. Third-party liability. This is basically private insurance. This is when someone has coverage outside of OHP, and we do need those payments reported to us as well. So the question that comes in a lot is, what if TPL pays more than the CCO, but less than the encounter rate? And again, the purpose of the wraparound is to make the clinic whole up to the encounter rate for eligible services. So you want to, again, report all the services that are provided and all the payments that are received for those services from third-party liability and or CCO. So if the third-party liability pays more than the CCO would have and the CCO doesn't pay anything, we still want to see those payments. And then again, wraparound payments are made in aggregate and not per claim. Timeframes for claims and wraparound. So clinics submit the claims for the services to CCOs within 4 months of the date of service. And then we have some timely filing over on our side for what we require CCOs to submit to us. They submit their encounter claims to us within 180 days of that date of service. And then again, federal law requires that we make those supplemental payments at least every 4 months. So we've set up in our rules that we would do that at least quarterly. Again, a lot of rural health clinics are doing that on a monthly basis, and that is perfectly fine. That is working well. And then we process on a quarterly basis, including any final reconciliation, referring to the rule there again. And if you are a rural health clinic that is submitting monthly, again, I'm saying the quarterly basis because that's how we have it set up in the rule. Doing it on a monthly basis, settling with you on a monthly basis is fine. The federal law actually says at least every 4 months. So if we're doing that on a monthly basis with you, that is working well. And then preliminary data and expected payments that you're including on your wraparound report, those are settled at a later date once we have the CCO payment, and we can look at those in our encounter data in MMIS from the CCO. Case rates, this is a simple one here. We need you to report the case rates when they occur. They are like capitation payments. So you'll report those on that cover page under one of those sections there. CCO encounters in MMIS. So again, CCOs are required to submit their paid amounts to us within 180 days of the date of service. So once you get that turnaround where you've submitted to them within 4 months, they have an additional 2 months to get those encounters over to our MMIS. And then a few instances when encounters might not be present in our MMIS, so we wouldn't be able to make that comparison, is if the claim was denied by the CCO, if the service was subcapitated, or if it was included in another service. So that's where we're looking at the possibility of having a global code if it's included in another service, and we would need those individual encounters listed out in the raw data on the wraparound from you. And then another reason is when another payer paid more than the CCO's allowed amount. So then we're running into that other frequently asked question where third-party liability paid more than the CCO would. Then we're not going to see it in our system because they would not submit any claims that didn't pay or any claims that denied. And then pre and post OB encounters are not reported to MMIS. So you do want to submit those individually as encounters, again, on the raw data worksheet. And here's a few resources for you. I am really quick just going to mention again, no bonus and incentive payments. I like to really get that out there. That's been a hot ticket item for a little bit. So want to make sure that you know we don't want those because those are intended to be bonus and incentive payments for you. So here is the website to our FQHC RHC program webpage on the Oregon Health Authority website. And then on that page, you'll find the wraparound data template, but I wanted to give you a direct link as well. And then we do have a list of procedure codes that are excluded from the PPS encounter rate payment. And that's available, again, on the main page, but I wanted to give you a direct link. And any procedure code on there is either not payable at all, or it's something that we pay at a fee-for-service, like a max fee kind of rate, instead of at the encounter rate. And those are defined in our rules as well. So if you look at Oregon Administrative Rule 410-147, there's language around which services are not included, many of which are incident to services, labs and radiology, talks about multiple encounters in one day and when those might be paid, but typically there's only one encounter allowed per day per member. So lots of good stuff on our website. And then your contacts. So there at the top, that's me. If you have any questions about policy, payments, if you want to know more about that APCM program that I mentioned briefly at the beginning, please go ahead and feel free to email me or call me. Full disclosure, I'm better at email, so I really do try and pay attention to my phone, but sometimes I plug it in and I kind of just walk away from it. So there's that. And then my fiscal analyst that actually works through the wraparound payments, that's Eric Larson, and here's his email address and his phone number. And he is the one who directly receives your wraparound. So once you fill out that template, you'll be sending those to Eric Larson directly, and he works through all the financial stuff and makes those settlement payments with you.
Thank you, Jennifer, for this helpful presentation today. We will now go to question and answer session. Okay. Can you give us examples of payments that should not be reported to OHA?
Jennifer, you want to do that one, or I can?
Go ahead, Eric.
So like she was saying, anything that's explicitly a bonus or an incentive, those would never be included. If you're receiving Medicare reimbursement and we are the secondary, then you would include those. Of course, all of capitation payments. I will say about capitation, if those are paid monthly, that's obviously very easy to report on your face sheet or your cover page of the wrap template. If it's something you receive on a larger span of time, like 6 months or once a year, we don't really dictate how you'll break that out to report on a monthly submission. That's kind of up to you folks, but generally it's probably some form of equal division amongst the months you receive that. So you can at least, that we can identify that on the that monthly reimbursement or quarterly or what have you. Outside of that, though, really, other than third party, anything that's explicitly involved with a Medicaid client that's covered under a managed care plan, those payments would be reported to us. Anything outside of that would not.
Thank you. Should a copay be reported as a payment?
That's very rare, but I will see those on occasion. So I would say yes. Again, if it's a Medicaid client and they had some form of a copay and they did make that payment, we would want that recognized.
Do we include total payments that are more than the PPS rate?
Well, since we look at things from an aggregate level, then it will most likely look that way. If we were doing wraparound on a per encounter basis, then in those situations, you wouldn't do that. But since you're giving me an entire population of encounters, an entire total payments, then as far as I can tell, I'm not seeing anything more than the PPS rate.
Okay. Is the wraparound payment under the RHC's ID? Is
Yes,
it?
it should be Medicaid ID.
Okay. Would an immunization only visit qualify for a WRAP payment?
Yes.
Okay. And the last question I have here, how far back can we go to claim the WRAP payments? Is there a timely filing limit?
Jennifer can help, but you should probably answer that first.
I didn't hear you, Eric. I'm sorry. Do you want me to go
Okay, I
ahead
think
and
you should probably answer that from a policy point of view, but I can certainly add my my part too.
Okay. So sometimes we run into just like timely filing or things not being paid yet and that kind of thing. So we are required to pay the wraparound payment. So regardless of, we do need you to report those payments as they come in. So even if the claim is older. Is that answering the question?
Yeah, I think it's answering the question. So if, let's say, an RHC hasn't sent in a WRAP report in 2 years, they could go back and send that in.
Yes, they could. The other
Okay.
thing is if a span of time goes by and they've discovered a population of encounters that they didn't include for whatever reason, I will accept those as well. We'll kind of treat that as an additional submission or a separate submission. But we will go back, depending on how much information is within the MMIS. If the encounters aren't there for a period of time that they'd like to submit, then that's not going to really work out. But if the data is there in MMIS and you need to go back a few years, yes, we're required to pay those.
Yeah, and I want to add a little something to that. Just as we'd like them to be fairly timely, because what we run into is we have a biennium that we operate off of in Oregon, and if claims wraparound payments, of course we're required to pay them, so please do send them. But what we run into is if we are outside of a set biennium and you're putting some old payments on the wraparound, we run into where we might not receive federal match for those wraparound payments. So we'd like to encourage you to get them in as timely as possible, but yes, please do submit them.
Perfect. We have a question from Kelly Singhos. And audience, if you have other questions, please submit them because we have some time. Let's see, Kelly is asking, can you expand how immunization only visits are paid by a wraparound payment?
Jennifer, I can answer that, or you can.
Yeah, go ahead, Eric.
I was going to say that, most of the time we'll see an office visit CPT come through with a couple of immunizations, some labs, what have you, and that all gets rolled up. But if a patient comes in just for an immunization, we do honor that as a separate standalone encounter. So that can occur in any given submission. I'll see bundled up services on one day, or I may just see a few immunizations. I don't know the logic behind that, other than we want to promote immunizations, and we do honor that as a standalone encounter.
Kim Vaughn is asking, will the physician need to see the patient for immunization?
That's you, Jennifer.
I don't think so necessarily. It really depends on, full disclosure, I'm not a coder. It really depends on the coding and what code those are being sent in under and what the requirements are around the code.
Okay,
But
thank
not
you.
necessarily, we can see those.
So that would be the same for a 99211 visit. That would be included on the wraparound report as well?
Yes.
Okay.
That one I know that code well.
I bet you do. Okay, well, that concludes all the questions I have at this time. Thank you, Jennifer, and thank you, Eric, both. It's always a pleasure to be able to talk to you and pick your brain about all these different questions. Before we end this session, I would like to introduce Rose Locklear, a program manager at the Oregon Office of Rural Health. Rose is responsible for telehealth outreach and education. She has an upcoming telehealth project she would like to briefly mention. So I'm going to go ahead and turn it over to Rose and let her review that project with you.
Great. Thank you so much, Ron. Again. So as she mentioned, I'm Rose, and you all have probably heard from me about listening tour things over the summer, which we had to take virtual. So we have an upcoming, a pretty exciting project in partnership with the Telehealth Alliance of Oregon, and in which we will be mapping the telehealth services that you all are providing at your rural health clinics. So I just wanted to give you a heads up that you'll be receiving some outreach communication from me asking about this and scheduling a time to have a real quick conversation. So thank you for allowing me to hop on and give a little plug for that, and I'll toss the ball back to Rondi, and thank you. Have a great session, you all.
Everyone, we will take a short break and return at 11:15 to hear Charles James discuss RHC telehealth and case management service billing update. He will also touch on COVID. Thank you again, Jennifer and Eric and everyone for attending this session. See you back at 11:15.